Hello and welcome to this Vibrant Publication summary video. Today we'll be talking about the study called Profiling the Effect of Micronutrient Levels on Vital Cardiovascular Markers. Let's get started. Heart disease is still the leading cause of death worldwide. Most people know about the usual risk factors like high cholesterol, high blood pressure, smoking, or poor diet. But there's something many people don't realize. The vitamins, minerals, and amino acids in your body can also affect your heart health. This new study from our very own in-house research team helps explain how your nutrient levels may raise or lower your risk for heart disease. This was a peer-reviewed study published in January 2025 in the journal Cureus. Specifically, this study was a retrospective analysis of 358 adults who had serum blood testing done for both micronutrients, including vitamins A, D, E, K, minerals like calcium, magnesium, and zinc, and amino acids like leucine, valine, and isoleucine, as well as heart-related markers like total cholesterol, LDL, HDL, triglycerides, ApoA1, ApoB, and Lp(a). By comparing these results, the researchers could see whether certain nutrients seemed to support a healthy heart, or whether having too much or too little might increase risk. This is one of the largest and most complete looks at how nutrients and heart markers connect. Here's what the study found. Number 1, fat-soluble vitamins like A, D, E, and K were positively correlated with higher cholesterol and triglycerides. In other words, people with higher levels of these vitamins often had higher cholesterol or triglycerides. This doesn't mean that vitamins necessarily are bad, but it does mean that too much of certain vitamins, especially from supplements, may shift cholesterol upward. Number 2, magnesium, calcium, and zinc showed strong links with lipid balance, highlighting how mineral status is tied to vascular health. What this means is these minerals were also linked to changes in cholesterol and other heart markers. The key message here is that your mineral levels need to be in the right balance, not too high or too low. The third finding was about branched-chain amino acids, or BCAAs for short. These are amino acids found in protein, especially in meat, dairy, fish, eggs, soy, and protein powders and shakes. Higher branched-chain amino acids were associated with lower HDL and higher triglycerides, LDL, and ApoB. To put it another way, excess branched-chain amino acids were linked with a more atherogenic or harmful lipid profile. On the flip side, asparagine and glutamine correlated negatively with LDL, suggesting a protective role. The take-home message here? Both deficiencies and excesses in micronutrients can disrupt lipid regulation and cardiovascular balance. And your body needs the right mix of amino acids, not just high protein intake. Why does this matter? Because it means we can't just focus on cholesterol alone. Nutrient imbalances may silently drive cardiovascular risk, and standard lipid panels don't tell the whole story. Too little vitamin D or zinc might worsen lipid metabolism. Too much vitamin A or excess amino acids may also push patients towards risk. This highlights the need for precision testing, looking at both cardiovascular markers and nutrient status together rather than in isolation. Most people never check their vitamin or nutrient levels, but this study shows that these levels may play a bigger role in heart health than we thought. For example, low 25-hydroxy vitamin D or too much supplemental D3 could impact cholesterol. Low levels of certain amino acids may reduce heart protection, and mineral imbalances can throw off cardiovascular function. This means that even if you eat healthy, your body may still be missing or holding on to important nutrients. In other words, testing gives you clarity. The exciting part is that Vibrant Wellness makes this translation possible into practice. Vibrant offers a test that were used in this study, including the Micronutrients Panel, which evaluates intracellular and extracellular levels of essential vitamins, minerals, antioxidants, and amino acids using gold standard mass spectrometry technology. And this study made us rethink micronutrients entirely. Stay tuned for exciting updates in the future. Vibrant also offers the CardioZoomer, which assesses a full lipid and lipoprotein profile, including cholesterol, triglycerides, LDL, HDL, ApoA1, ApoB, Lp(a), and many, many more. By combining them, clinicians can uncover the exact nutrient patterns influencing a patient's cardiovascular risk. This allows for personalized, actionable interventions, whether it's dietary changes, targeted supplementation, or closer monitoring of at-risk patients. In summary, this study is the first to broadly profile micronutrient effects on multiple cardiovascular markers. It shows that both nutrient deficiency and excess can disrupt lipid balance. It underscores the importance of monitoring micronutrients to truly understand and modify cardiovascular risk. If you'd like to read the full publication, check out the link in the video description to access this study. If you're a provider, this research highlights how Vibrant's micronutrient and cardio health panels can give you a deeper view of your patient's heart health. And if you're a patient, let your provider know you're interested in Vibrant's micronutrient and cardiozoomer tests. For more details, you can explore the full publication or review sample reports to see how this data translates into clinical practice. Together, we can bring precision and prevention to the forefront of healthcare. To learn more, check out the links in the video description. If you have questions, please ask them in the comments below this video. Thanks for watching, and I hope you have a vibrant day.